2, 1.
Happy the Friday the 13th. We got a killer show for you today with some monster topics. We're going to be talking about the show Awake Surgery, where people have major surgery while totally awake. Also, Sunny Hostin of The View is going to talk about her plastic surgery experience. And lastly, we're going to talk about some COVID vaccine misinformation rumors. It's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
What's up, everybody? Happy Friday. Welcome to Nip Talk. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, as always, co-host Sarah Bennett.
Hi.
And in the box is the man, the legend, Travis. What's going on, buddy?
What's happening? What's happening? I was about to say happy Friday, or happy Friday the 13th. There it is.
Oh, yeah. I've lost Travis. Can you hear Travis?
Yeah.
Oh, you can hear him?
He said happy Friday the 13th.
Oh, did he? Oh, wait, I hear him. Wait,
You
are you
hear me
there,
now?
Travis?
Check, check. Can you hear me?
No? All right. We're having a little bit of technical
I
difficulties.
guess
but
so.
okay.
It may be that
So,
cable.
anyway, welcome everybody to the show. We got some good topics today. Before we do that, I always like to see, anything happening interesting with you this week, Sarah? I know you started. You have a new job you're doing. Something?
Yeah.
Yeah, that's exciting.
I'm back at the corporate life.
Nice. Very
Yeah.
good. You like that?
Yeah. I just needed, some more options in my
Yeah.
life, I think.
I hear you. I mean, we all
Yeah.
have I have tons of jobs that I do. It's
Yeah.
like, I get it. Like, I'm one of those people just like you, where it's like I don't just do like my surgery practice. I got
A bunch of side things.
yeah side gigs. I mean, you
Yeah.
gotta have side hustles, right?
Yeah.
I mean, I think that it's good to branch out and how everything's going. So that's awesome. Well,
I agree.
I'm really excited for you.
Thanks.
I have a pretty interesting week as well. Like, I'm actually looking at right now I rent my office space, and so me and another surgeon are actually looking at purchasing a building.
Okay,
so that
cool.
we would actually own our office. Because right now it's kind of like the same thing as like if you're in an apartment and you're renting an apartment, like you're just giving money to someone else, versus if you own your house, then you're building equity.
Right, yeah.
So I don't know. At first, when I first started practicing medicine, I was like, man, I'm just trying to get my feet under me and get my practice going. I didn't have to worry about trying to be a building owner. But now with things, that's smoothed out a little bit. I think that it's probably the best way to go to actually own something. And then at the end when after you go to retire, you can always sell your building or whatever.
Right. Is the doctor you're looking at the other building with? Are y'all gonna have a practice together? Or is it gonna be separate?
It'll be separate. He's
Okay.
an orthopedic surgeon.
Oh, okay.
He's orthopedic and hand surgeon, and so we do a little bit of the same thing. Like I'm sure I've talked about taking the trauma call at that one hospital. He takes call with me, but we're not together. I mean, every once in a while we'll bounce ideas off each other, but I do mostly plastic surgery in hand, and he does orthopedics in hand. But he's a good dude. I really like him. His name's Dr. Tim Larson. He's up in Denton, and yeah, he's kind of on his own too. A lot of the doctors up where I work are in these big groups, or they're employed by the hospital, so
Right.
They don't have kind of the freedom to get their own building or whatever. But we do, and so yeah, we've been looking at one, and I don't know. I think it'll be good.
I think so.
I'm excited about that. It's kind of like a big step, though, right? I mean, because you have to take out loans, and it's like, man, I just am getting some of my loans paid off, and now I'm gonna jump back into being in debt again. But I mean, it's kind of like buying a house, though, right? It's
Yeah.
never a bad idea to buy a house. I guess I don't know.
If you can afford it. Yeah.
Yeah, in most circumstances. So, but yeah, so that's exciting. I'll have to keep you posted on that.
For sure.
But yeah, and it's been busy for me. I've been really busy the last 2 weeks, surgery-wise, and I've been on call a lot. And I think I'm on call the rest of the day, but starting tomorrow I'm off. So I'm looking forward to a chill weekend.
Yes, I get a 3-day weekend as
Do you?
well. Yeah.
Yeah, I ended up working both Saturday and Sunday last weekend, which it wasn't terrible, but it just sucks when you think you're gonna have a day off and you have to go into work. It's I mean, I get it. It's with my job, right? But you do like to have days off.
Yes.
So, anyway, well, Travis, can I hear you over the overhead? If you go over the overhead, can I hear you like that?
Maybe so. Check.
Oh, there we go. All
Can
right.
you hear me?
Will that mess us up if you do like that? I think.
We'll try it for a little bit, and then we'll kind
Well, I
of go
just
to
hate
something
not
else.
hearing from you. Like, if we have to go the whole like episode and like I can't have you chime
Hey,
in.
I'm used to being voiceless, man. It's okay. It's okay.
Did you have a good week, Travis? I know
I
you said
did.
you're busy, but
Yeah, I did. I had a pretty good week. I found out, I guess on Monday, this coming Monday, I'll be a part of a parade.
a parade.
Yeah, they have
like on a float.
Yeah, basically we have. So I work for a radio station, of course, outside
Right,
here,
yeah.
and then we have a MLK parade that's happening
Nice.
on Monday, and I'll be in the parade on the float. Like
That's
with
so
my-
awesome. So are you on
Yeah.
like a particular like float for I guess the radio station itself or what?
It is. It's
Oh,
for the
nice.
radio station. So
So I know you've talked a little bit about your radio show. Like, what is the gist of your radio show? Like what's the name of it? Like, what do you guys talk about?
So I am on a show called Dee Dee in the Morning. She is like a local radio personality here, but she's syndicated like throughout the country. So
Okay.
she's in I think like 76 other like cities.
Oh wow!
I was about to say states, and then I had to catch myself.
Gotta recount those states.
Yeah, she's in like 76 other cities.
Yeah.
But I do that, and then I also have my own show on like Sundays that I do.
What's your show about?
So it's just basically me like playing music, like introing music, outro music, like not intro music and outro music, but I introduce music and I talk over music, and we just play like hip hop, basically.
You're kidding?
Yeah.
Have we ever taled about the fact that I'm really into music? Like I make music and stuff?
Yeah. We talked about your shirts. I'm sure you have one on under your scrubs, like your music shirts.
I actually do. I had to look, I couldn't remember. I have a Metallica
Yeah,
shirt on.
Exactly.
Yeah, we'll have to talk about it sometime. I'm actually doing making. Do you use like DAWs and stuff to do this, or are you just more playing it?
Yeah, so I'm just more so like just introing the music, saying,
Oh, nice.
hey, that was Lil Wayne and Drake or something like that. You
Awesome,
know what I mean?
man.
Yeah, exactly.
I'm gonna have to tune into your show. Like you'll have to give me the info.
Let me know when you tune in. I'll give you a shout out.
That'd be awesome. That'd be awesome.
I got you.
Right on. All right, have you guys? So I'm gonna move on to our first segment, and
Okay.
I really wish I could remember the person on social media that told me to look this up. I hope they see this. And one, I want to apologize for not remembering your name. I'm gonna go look it up, and I'll give you a shout out next time. But I want to thank you for telling me to go look up this show called Awake Surgery. Have you guys heard of this?
I've heard of the situation, but
Right,
I've
the
never.
idea of it. Travis, have you heard of it?
I've
Awake?
not heard of it before.
So this person was telling me about the show, and I was like, "Oh, that's interesting." You know,
Sounds like a nightmare.
having people be totally awake for surgery. I mean, I'm going to talk about my experience with that because I actually do have some experience in doing surgeries like this. But this person on social media was telling me that they were doing these like really like big surgeries, and I was like, that doesn't sound right. And so this week I actually watched. So it just came out. It started like in December, and there's 3 episodes. It's on TLC, I believe. And I watched 2 episodes, and like, I really think I hate everything about this show. Like, I just have I hate to be that guy that's like, this is not good, but man,
Is it just like misinformation, or is it just?
No, and we'll talk about that. We'll just have to dive into it. I want to show you. So all I didn't want to show like an episode of the show or anything. I
Right.
just got a little snippet of their intro,
Okay.
which their intro shows like some of the things that they're doing. And so I just want to roll that video. Travis, do we have that one?
I'm Dr. Megan Gruber. I'm a board-certified plastic surgeon, and I specialize in surgery on patients who are completely awake. I've been operating in hospitals and in the operating room for almost 20 years. I found a method that I can do with no general anesthesia and no sedation at all. There are so many procedures that I can do while the patient is awake.
You clearly see it's hanging.
I would like to have the hourglass shape.
My man boobs have to go.
There's no limitations.
It looks like a man's ball sack.
Awake surgery can really branch out to many more patients who can't go under anesthesia. You're standing up during
surgery.
or patients who are just afraid of anesthesia.
Oh, this feels kind of good, like a massage. Best massage of your life.
So anyway, I just want to show like just a little snippet of like what they're doing. I mean, just so you have the idea, right? That they're doing, and that doesn't even get into. I watched 2 full episodes, And so this is Dr. Gruber in of all places, Florida. It seems like every time that like I talk like about something I don't like, it's in Florida. I don't know why that. I mean, I like.
There's a lot of things I don't like about Florida.
I mean,
and I'll just add that to the list.
I mean, Florida's a beautiful state, and we used to vacation there a lot. But man, it seems like every time you hear something crazy going on, it's out of Florida.
There's always something wrong with somebody if they decide to move to Florida and they're not from Florida. There's like, I don't know.
I mean, I like it there. Like,
there might be, if you like, I mean, if you go there for vacation, totally cool. But if you decide to like move there for the rest of your life,
I should like reevaluate my life.
You're a questionable person.
So this is Dr. Gruber. She's a board-certified plastic surgeon. Like, so she's totally legit. She's in Florida, and I cannot believe this is her whole practice. I just can't believe it. But she is doing these pretty major surgeries with zero anesthesia, zero sedation, completely under local anesthesia, and she has a TV show about it. And man, I just, there's a lot that I need to.
Well, it gave me anxiety. Like, I usually don't get like uncomfortable watching like surgeries.
Yeah.
Right.
But knowing that they were awake, seeing that they were awake, it made me like not want to look at it. It gave me like, ugh.
So I want to kind of go through some of the things that I learned watching the show. I mean, the first thing, and these are quotes directly from this doctor. One, she said that there's no limitations on what surgeries can be done awake. Wow, I mean, I have to disagree with that.
That sounds questionable.
I mean, you can do a lot with local anesthesia, but I wouldn't say that you can do any surgery safely. I mean, technically, yes, you could do anything. I mean, heck, you know, in Civil War days, you used to cut off legs with no anesthesia at all, right? So technically, yes, something could be done. But I have a little bit of a problem with that. And then she was saying that awake surgeries branches out to patients that can't go under anesthesia. So I can imagine that, you know, because I'm asking like, why are you doing this, right? And so a response that I would have expected someone like that to say is, well, you know, there's patients that can't go under anesthesia, to which I would say, I mean, anesthesia is not like it used to be. You know, 30 years ago, anesthesia had some serious risks. Nowadays, I mean, it's like air travel, right? It's like, you know, yes, I mean, theoretically flying in a plane through the sky is dangerous, but statistically it's not.
Right.
Like, it's extremely safe. And when patients come to me, you know, in my office and they say, well, you know, is anesthesia safe? Which doesn't happen very often anymore, but when it does, I say, you know, statistically it's more dangerous to jump in your car and drive to the surgery center and get anesthesia than it is to get the anesthesia, right?
Yeah.
So, and the other thing I would say is that, I mean, if a patient truly is too sick to go under anesthesia, because there are patients, like, say if somebody was about to have a heart attack, you would never want to put them under anesthesia, right? Those patients shouldn't be having the procedure anyway,
right?
You know, so that whole thing about this opens up for people who can't go under anesthesia is, I mean, I don't want to say nonsense, but like, it doesn't really hold water for me.
So I may have missed it. How exactly are they not feeling it? Because she was going in kind of tough.
So, and thank you, because I kind of got really on my soapbox and I glossed over that. So they're using local anesthesia. So you've been to the dentist, right? And they inject, you know, they inject you with a medicine to numb your teeth, right? Yeah. It's that on a much grander scale. They use lidocaine and ropivacaine are the two that I think she's using. She was mentioning it in her show. And so, and you can accomplish a lot with that. And I'll kind of jump into like my experience with it, because I'm not somebody that's never done stuff similar to this. I've done facelift and neck lift under local anesthesia. I've done breast augmentations under local anesthesia. And I've done some liposuction under local anesthesia. In addition to like much smaller things like mole removals or something like that. But I'm talking like bigger surgeries. Like facelift neck lift is not too uncommon to do under local. Liposuction, breast augs I just did as like an experiment. I mean, not like I'm experimenting on my patients, but like there was a facility here that was doing a lot of facelift and neck lifts under local, and they had asked me, can breast augmentations be done? And I was like, yeah, they can be. It's just a matter of, you know, how comfortable is the patient going to be, and like how long does it take you? Because it's a much longer procedure to do things under local, because you have to get them numb. And I did a couple, and the patients did fine, but I didn't like it, you know, because, you'd have to like inject them with local, and then you'd start, and then you get to a point where maybe they were feeling something, you'd have to inject them with more local. And I did 2 of them, and I was like, yeah, it can be done, but like I just don't see the benefit of it. You know? Because to me, that's the question, is like, why? Like, why do this? You know, there's not a whole lot of benefits. But you know, my biggest issue is with that is the level of surgeries they were doing, and I'm gonna kind of go through them all. So I watched her do a gynecomastia repair, the man boobs.
Yes.
And so, you know, with that one, like, I mean, that's actually a fairly reasonable surgery to do under local. You know, it's not a large area. You can numb it up, you can lipo it, you can take up the skin. I mean, I don't have a problem with the fact that she did that under local, but I had some other problems. Like, one, they didn't have the patient on a monitor at all. So like, you know, when you're in surgery, they at least monitor your heart rate, your blood pressure, that kind of thing. So there's no monitors, but then they had the patient stand up, and the patient got woozy and literally collapsed. Like, and they put this on TV. Like, if you have a patient in a facility like a hospital or surgery center and they fall, like, that's a reportable event to the state.
Yeah.
And you know, and they had these patients like stand up while they're, you know, watching themselves get cut open, and this guy just like went, you know, he went down and like he fell into the bed, so he wasn't like hurt, but wow, I just couldn't believe that they put that on TV.
Did he fall because like of, I guess, the procedure they were doing, or did he fall because he was seeing it like happen, like, and he
I'm
just
not
kind
sure.
of passed out?
Yeah, I'm not sure. It could have been he got too much local anesthesia, because that's, to me, that's like the big one, and I guess I'll jump into that right now. You know, one of the biggest issues with doing surgeries under local anesthesia is there are toxic levels of these drugs. Like lidocaine and ropivacaine are deadly if you give people too much. Now, fortunately, you don't go from I'm fine to I'm dead. You go from like I'm fine to I feel kind of drunk to I feel kind of sleepy, and then like you can get into these heart arrhythmias, and then that's when things get really, really dangerous.
Yeah.
And so when I was doing a little bit more local surgery, you know, the biggest kind of barrier to doing it is, you know, how much local anesthesia can you safely give the patient? And there's formulas for that. And I just found that it can be quite a balancing act to give a patient enough local anesthesia that they're comfortable, but without hitting that dosage that's dangerous. And, you know, going on, I'm going to talk about some more surgeries. They did some really big surgeries, and they didn't have people on monitors. Like, if you're giving someone a drug that can potentially, you know, put you into an arrhythmia, a heart arrhythmia, I just really feel like there should be a little bit more monitoring.
Yeah, it just sounds like they're pushing the limit on something that really doesn't need to be tested.
Yeah,
like there's no reason for it.
You know, the other thing that I found when I was doing things under local is, I mean, I think without question, it adds a level of risk and danger when a patient can unexpectedly move on you.
Yes.
You know, like, especially with things like liposuction. I remember one time I was doing some spot lipo on somebody, and it was just a small amount, so not something that really, you know, was a large thing or that I thought was like, you know, unsafe. And she was numbed up really well, and I got somewhere that she didn't have enough anesthesia, and she jumped. And, you know, this is while I'm doing liposuction, and if someone jumped enough, you could potentially cause an injury that would never happen if the patient was asleep. And so, you know, you have the risk of the local anesthetics, you have the risk of patients moving. I mean, to me, like, having a patient be completely awake for major surgery just adds too much risk, and in my opinion, no benefit. You know, what is the benefit of having the patient be awake? The whole argument of like anesthesia is not safe does not hold water. You know, I guess if you had like patient, you know, request, I mean, because I do like to honor patients' requests when I can. And if I have surgeries where local is an option, I absolutely will do it, even if it means it inconveniences me a bit because, you know, they're awake. But if it's going to add risk because the surgery is too big, then I personally have a problem with it.
Yeah.
So she did a gynecomastia repair. Oh, the other thing, they had family in the OR, which, man, I just don't know if that's a great idea with major surgery. You know, if somebody were to have an event where something unexpected happened and they started to like rapidly bleed, or they started to have an event where it was like an emergency. I mean, having a family member in that scenario is a super, super bad idea. I mean, it can actually hinder a physician's ability to administer, life-saving care. So I just had a lot of issues with it. I had the issue with no monitors. There was like not a lot of sterility going on. I mean, I know that they prepped them, but like when I do surgeries, we prep it, we drape everything out with sterile towels to, kind of cordon off the area that's going to be sterile, and you don't move them around. They'd have people get up, move around. I mean, you lose your sterile field, and without question, that does increase risk of infection. And maybe she's never had one. I'm just kind of seeing the things that kind of come to my mind when this is happening.
Yeah,
so,
it just seems really scary.
Is this the first season?
This is the first season. I cannot imagine that this show is going to have another season. Like, I'm wondering if it's even.
They're going to be on the news.
I wonder if it's even going to finish. Like, I was watching this, just thinking, wow, there's just so much to see here
so
that
much
really
wrong.
doesn't need to be seen.
Yeah.
I hate to say it, but I mean, and maybe she has the best outcomes ever. I don't know. For me, I like to be as safe as possible, and I was uncomfortable watching some of those things.
Well, personally, just having a C-section and being awake during that process, like I would never opt to be awake during a surgery.
Yeah.
That was so.
I mean, at least with a C-section,
it gave me
you have
so
the
much
spinal.
anxiety. So I don't know why somebody would want to be awake and be like present as somebody's like cutting into your skin. It's just so weird.
I know, it's crazy, right? So I watched another surgery where they did a brachioplasty. A brachioplasty is like where they take out the extra skin of the arm. And the doctor literally halfway through the surgery said, I don't know if the patient's going to be able to finish the surgery. I mean, how could you say something like that? I mean,
and the patient was just like,
well, because the patient was uncomfortable.
Okay.
The patient was uncomfortable, and so the doctor's like, I don't know if the patient's gonna be able to finish surgery. And perhaps that was just for drama, for the show.
Yeah,
I
for
mean,
TLC.
I don't know, but like, that is like one of the biggest, potential problems of another potential problem of doing something under local anesthesia. The patient can't tolerate the surgery. Suddenly you have them open,
you have a huge
like they're
time.
open, and then what? You have to transport them by ambulance to the emergency department and then take them to surgery. I mean, there's a lot of potential badness that could happen. They had a patient in there for lipo of the neck, which I've actually done that under local. I mean, it's a little anxiety inducing because you don't want the patient to move, when you're liposuctioning the neck.
Yeah.
And so you have to make sure the patient's going to be okay. And but what really caught me on that one is the patient's family members said that they were sensitive to like blood, and they still brought him in the OR. So then you have the potential of somebody like passing out in the OR and like hurting themselves. The big one though is they did they did both a paniculectomy, which is a massive skin removal of the abdomen. It's kind of half of an abdominoplasty, which she called an abdominoplasty, which is not what she did. She did a paniculectomy, which was really weird for a plastic surgeon and mislabeled procedure. I'm not sure that means anything. My issue was it took them 2 days to do the surgery. They couldn't do it all in one day. And I'm sure that's because of the anesthesia issue.
Yeah.
They could not give her enough local anesthesia safely to do it. So they had to do it over 2 days. They didn't have her on a monitor. I mean, these are surgeries where patients have fluid shifts where they can actually, have cardiac symptoms from the amount of tissue you're removing or the amount of fluid you're giving or the amount of blood loss. No monitor, nothing like that. I mean, it was wild. I had a lot of issues with that show.
I didn't even watch it, and I have so many issues.
And maybe I'm just being like overly cautious, but I mean, I feel that as a plastic surgeon, we should not be afraid to say that I don't know if this is safe,
Yeah.
And you see that in every hospital, signs that say, if you feel something's unsafe, say something. And that's what I'm having to do. Like, I just have serious questions about that. And I know I'm not alone. I know if I like sent that video to some of my plastic surgery colleagues, they would be like, what in the world is going on?
I wonder where is the pool that they find the people from
that
like agree to it.
Thank you so much, because that's another thing, because now they're getting medical tourism, which you know how I feel about medical tourism.
Oh, I got you, yeah.
There are people in the United States that don't want to have anesthesia for whatever reason, and now they're flying there and doing the surgery.
Is it just like just weirdos that just like don't like want to see the surgery? Like they like want
I don't know
to
what the
see it or
reasoning
something?
is. Some of them, a lot of the people, and I did watch
Or
I watched 2 full episodes. A lot of the people said, I just am scared of anesthesia, you know, which
Yeesh.
I get that, you know, but I feel like as a doctor, you should step in for bigger surgeries. Little stuff, sure, do it under local, that's fine. For bigger surgeries, step in and say, you know what, I understand your fears, but statistically, it's more risky to do it under local than it is to do under anesthesia. I mean, I would love for that doctor to come on the show and us talk about it in a very cordial way, just because I have serious questions, you know, about it.
Maybe if they have an email or something, like reach out to them and be like, hey, I have a podcast. You should come on sometime.
I would love for her to come out. I mean, she
Yeah.
seems like, you know, nice. And I was looking at her results and, you know, I mean, you know, acceptable plastic surgery results.
Yeah.
But yeah, wow. Just the whole thing about, you know.
But like an unnecessary route to like get there.
That's a good way to put it. It is. It's an unnecessary route to get that result that you want. And I don't know, like, you know, is she doing it to make a niche? I mean, that happens literally all the time in plastic surgery, where people will say, oh, I'm the awake surgeon doctor, you know, knowing that there's enough people out there.
Kind of like how you want to be the elf ear doctor.
I want to be the elf ear doctor, exactly like that. Yeah, and so I don't know if it's that, or I would love to talk to her and ask her, why are you doing this?
Like,
what's the point?
Yeah. It's
You know,
the
and
point. I'm sure the point is to be on TLC.
Potentially, and it could be that.
Yeah.
I mean, I hate to say it, but it could be that, you know, oh, we'll give you your TV show if you do this thing. To which, if somebody told me, I'll give you $1 million to do this show, and you know you have to do X number of episodes, but you have to do these surgeries, I'd be like, you got to be kidding me! You want me to do that, and you're going to put it on TV? No way! Like, I am out.
Yeah.
So I don't know. I mean, it's crazy. You should watch an episode. It's pretty wild. I mean, and it's worse being.
I could barely watch it. Like whenever
Watch the
you
intro.
showed the intro, I was like,
The worst part is being like a plastic surgeon and seeing these things and just like, oh man. Yeah, I haven't been like that kind of just concerned about something I've seen in a while. I just like, it's like everything, I hate everything about this.
yeah.
Anyway,
I did
Awake
too.
Surgery. Check it out. It's on TLC. You can go watch it for free, I think. I've watched it. I don't know if I have like a subscription or what, but I just pulled it up and it started playing.
I'm sure there's all kinds of stuff that they can watch.
All right, Awake Surgery. I think, and I'm just going to end with, there are plenty of surgeries that can be done under local with no anesthesia. My concern is mostly for these really big surgeries they were doing.
Yeah.
You know, so.
The big ones.
All right, leave me a comment. Awake Surgery. If you've seen it, you like it, tell me what you think about it. I'd love to hear about it. Okay, I'm moving on. We're moving on.
Good.
You know, have you ever watched the show The View?
Yes.
I never watched The View.
I mean, I don't watch it like
It's
consistently.
on during the day, right?
I don't know. I've seen
I know
maybe
of
some
The
of
View.
it.
I mostly know of The View because I hear like people talk either good or bad about it. You know, it's like, oh, something happened on The View. You know?
Is Whoopi Goldberg on The View?
She is. I was going to ask you guys, how many people can you name that's on The View?
Isn't Raven from That's So Raven on there?
Yeah,
still?
I think
What's
she's
her
on
name?
there.
Is it Raven?
Raven Simone is
Raven
her name,
Simone.
and then
Yeah.
Not on there
Joy-
anymore.
She's
who?
not. Joy Behart.
Yes.
She's on there.
Right.
Whoopi.
Yeah.
And I couldn't name the other.
So I could name.
Sunny.
Yes, there you go. Sonny
Yeah.
Hostin, yeah. So I could have named Whoopi, Joy Behar, and I've heard of Sonny Hostin. There's 3 more. I didn't know there were 6.
Oh, wow, that's 3.
Anna Navarro, Sarah Haynes, and Alyssa Griffin. I don't know who those people are. I never heard of them. I just don't. It's not my thing. I just am not like a View watcher. Anyway, so
Yeah.
the reason we're talking about The View is Sonny Hostin, who's one of the hosts of The View, did an interview with People Magazine just this past week, and she was talking about how much she loved her plastic surgery. And I was
Okay.
like, wow, that's really interesting, you know, because most celebrities don't, you know, talk about plastic surgery, or they will say that they had a bad experience. And I was like, wow, I wonder, you know, what she had done that she loved so much. And so that's, you know, I got interested in seeing it. And so she did a breast reduction, and she said she had a breast reduction, but also had some liposuction, and she loved it so much, she just wanted to talk about it. So I got a quote from her. It says, I thought I would feel shame, like, oh my God, I'm doing plastic surgery like all these crazy celebrities, but I don't feel shame at all. And I hope sharing my story will help more people. If they're feeling so body conscious the way I was, they can go do what they need to do and feel better. And when, in reference to plastic surgery, she said, I wanted to be honest, and I'm so happy I did it. I was like, well, that's so nice. And so, I wanted to kind of just talk about that a little bit because, of course, I want to know what she had done. It's like, what plastic surgery procedure did she have done that made her so ecstatic? And if I had to have guessed, I would have guessed that breast reduction might be one of them.
Every time somebody gets a breast reduction, they're always like, thank God.
I agree with that. I honestly built my practice doing breast reductions. When I moved up to where I'm at now, for some reason the guys that were there were not doing a lot of them, and there was just a ton of people that wanted them, and I was doing 2 or 3 a week forever. And this is back when insurance would pay for them, which we'll talk about in a minute. It's kind of changed. So Sunny went from reportedly a G cup down to like a C/D cup, which is that's a pretty impressive reduction.
Yeah, that's a lot.
Well, I found it interesting though that the People magazine they were quoting the cost of having the surgery, which they're basically acknowledging that you can't get it covered by insurance anymore, which we'll talk about in a sec. But they were saying a breast reduction costs anywhere from $10,000 to $30,000. Like, where are they getting $30,000 for breast reduction surgery? I want to move there like right now.
Go to LA, I guess.
So like in my practice, if it's out of pocket, which they mostly are these days, I asked my office manager. It's for everything all in $9,000. So we're actually under like their lowest range, which is good. And that actually has just gone up. I don't know if we ever talked about this, but with all of the inflation stuff, the cost of plastic surgery has gone up about 30% in the last year.
Yeah, are breast reductions more expensive or cheaper than breast augmentation?
They're actually fairly comparable because with breast augmentation, you have to pay for the implants, which are around $2,000, depending on which kind you get. But the difference is that breast reduction doesn't have the implants, but it's a longer surgery.
Yeah.
It's about twice as long to do a breast reduction. So the costs are fairly close. I can't remember what we're getting for augmentations now, but I think it's a little bit less than that, but not like half of that.
Yeah, mine was definitely cheaper.
Yeah.
But I got
You had yours done like a while back, right?
10, 11 years ago.
Yeah, 10, 11 years. Like 11, and you did saline, right? I mean, saline implants 10 years ago, you could probably get the whole thing done for $3,000 or $4,000.
Yeah, it was around there.
Nowadays, no way. Not around here. Maybe like somewhere sketchy, like you
Florida.
Yeah, Florida. If you're awake.
If you're awake.
Sorry.
Gross.
Awake.
Ew.
All right. So yeah. Anyway, so it was funny. They were quoting these like insane prices, like $30,000 for breast reduction surgery, $8,000 to $30,000 for liposuction. I guess that's Beverly Hills or New York City. Maybe they're getting that much money there.
That's what I'm like.
We're not getting that much money, at least where I'm at. Now, the closer you get to downtown Dallas, the prices do go up. So for me, it's around, I think, $9,000 all in. I mean, if you were in like downtown Dallas, it'd probably be closer to 12, I would guess. It does go up if you get closer to the city. So I just want to talk just for a second about breast reduction surgery because what you said is exactly right, that, most people who have that surgery just love it. And so I want to talk about the reasons why that is. Because I've heard so many times in the patients I've done breast reduction surgery on, oh, I wish I had done this 10 years ago, and this is the greatest thing ever. I hear that literally all the time, and that's why I kind of struck a chord whenever she went on to say that, because my experience with that is the same.
Yeah.
So breast reduction surgery accomplishes 3 things very well. It reduces the breast size, which is good.
Yeah.
It reshapes the breast, because a lot of times when the breasts get large, the shape, that nice kind of form, starts to get lost a little bit.
Yeah.
And it also lifts the breast. So you're doing 3 really important things. The biggest thing that patients will tell you after they get it done is any strain that they had on their neck, shoulders, back, or whatever is gone instantaneously. Like when they wake up, they're like, wow, I feel so much better already, even though I just came out of surgery.
Yeah.
And that's, I think, one of the biggest reasons that people like it is, most people that are coming in for breast reduction are at the very minimum a double D. You don't get a lot of people in the D range coming for it. And when the breasts get that large, just the weight of them starts to cause stress, shoulders, neck, back. And then also the fact that the breasts hang farther away from people also puts even more strain. I always give people this example when they come in for breast reduction surgery. It's like half of the surgery is just bringing them where they belong. Because if I was to take this coffee cup and hold it like this, I could probably hold it here for a couple of minutes, but eventually it's going to start, causing discomfort to me because it's not in a very, ideal location. If I were to take this coffee cup and put it right here, I can hold it for a day, because it's less stressful. And that's one of the reasons that breast reduction surgery is so beneficial in taking that pain and stress off. And then people always look better. As long as the surgeon is good, people always look better after breast reduction. Always. The shape gets better, just the position of the breast. It has a pretty easy recovery. People, when I describe the surgery to people in a consult, and I say, oh, well, I take the breast apart and I move the tissue and then I cut off the skin and I close everything up. People are like, wow, I'm going to need to take like a month off work. No. I mean, at the end of the day, when you do a breast reduction, you're operating on skin and fat. And when you operate on skin and fat, there's just not that much recovery, even if it's fairly involved.
That's good.
The last thing I always say about it is that if you're going to shop around for a breast reduction, that you should find a surgeon that does what's called a short scar breast reduction. Nowadays there are two very distinct ways that this surgery is done. There is the anchor pattern called the Wise or the keyhole that's been around for about 100 years, and then there's the short scar variants that have been around for about 20 years. And I was initially trained to do the kind of classic way, and then when I did a fellowship in breast, I was taught how to do the short scar, and that's all I do anymore. I would never do the old school way because the risk of healing problems is so much higher. The short scar gives you about half the scar, and it gives you just a tiny fraction of the risk of healing issues.
Yeah.
So if you're out there,
makes sense. I said makes sense.
Yeah, I mean, surgery in general moves towards being less invasive.
Yeah.
And so, plastic surgery is no different, and that's just one example of, in plastic surgery, how we're making things easier with less risk by, it's actually harder to do it that way, because people always ask me when they come in for a consult, oh, well, if this way is so great, why does the other way exist? Well, it's actually more challenging. It's more
challenging for a doctor.
Yeah, definitely more challenging.
Yeah.
I mean, I had to do about 50 of those short scars before I really felt comfortable with it, because of the fact that it's less mechanical, step-by-step, and more artistic. It is a very artistic surgery where if you don't have the eye for it, you can get off the path and end up having an outcome that you may not want. So, but yeah, I appreciated the fact that she went on and said all those nice things, because one, I mean, it's interesting to me because I do those surgeries, and two, I think it's good that people, hear that it is okay to do things, to improve upon yourself and not feel stigmatized by it. I think nowadays, not as many people feel the stigma of, oh, I had plastic surgery, but some people might. And for her to come out and say that, oh, I did this thing and it was just such a great experience, I think one is I don't want to say brave, but it's big of her to do that.
Yeah.
I mean, she could have not said anything, and I think she's doing it in a good place of wanting to help people, and I just admire that. So.
Yeah. That's a good story, though.
Yeah, it is a good story. It's nice to have like a plastic surgery celebrity story where it's not like some disaster.
Yeah, like what's wrong with her face?
Oh my God, what happened to this person? No, this is a feel-good story.
Yeah.
For Friday the 13th.
It's a bright side.
Yeah, it's a bright side. All right, we got one more segment, and this one's controversial, and I want you guys to weigh in. So we're gonna be talking about COVID.
Okay.
Well, COVID vaccines actually. So. I'm actually like a good person to talk about this because I am not on any fence or camp when it comes to vaccines. In fact, I hate to say this, I don't take the flu vaccine. I know I've actually come on the show and say that it's a good thing to take it, and it really is. The reason I don't take the flu vaccine is basically that the hospitals try to mandate that you take it, and my response is that, well, some years it's only 10% effective. Why would I take a shot if it's only 10% effective? And so it kind of became a thing for me where I felt like hospitals were robbing people of their autonomy. And so I kind of said, I'm going to take a stand, I'm not going to do this. And I've done that, and I've stuck to it. And I'm very careful. I don't think, to my knowledge, I've never had the flu. So my point in all that is, I'm not this person that's like saying, oh, go take every vaccine that anyone offers because it's the greatest thing ever and there's no risks. you know, I look at each thing and I say, okay, is this effective? Okay. Does it have, you know, low risks? And then I make the decision of, okay, for me, my decision, do I want to take this? You know, I'm against mandates of any sort. You know, I'm very kind of like a libertarian leaning person where I don't want people to be forced to do anything.
Yeah.
But when it came to the COVID vaccine initially, you know, back in 2021, I was actually all on board with it, you know, because one, I kept up with all the COVID stuff because I had to make policy for a hospital for it. And so I had to keep up with all the studies. And so I was following the trials for the COVID vaccine, and I actually read them. I didn't just like look at the sheet. I read the studies that said, you know, the effective rate was like 95%, and there wasn't like any big risk profile. So I was like first in line to take the vaccine. I took the first one, I took the second one, I took a booster, and I know for a fact that it helped me to not get COVID. You know, I had some very, very high risk exposures to COVID. My daughter got COVID like before she could be vaccinated. And I didn't know she had COVID, and she was like literally like right up against me for like 2 days when my wife was gone. I didn't get it. I mean, I know that it like, you know, it was effective for me.
Yeah.
So, of course, with COVID, things have changed so much in the past 2 years. You know, all the new variants came out. Do you guys keep up with this COVID stuff? I mean,
yeah,
a little bit.
I mean, I had to because of like owning a business, and like you had to like close the store, or like if you had to wear masks and stuff.
Oh yeah, it really affects people, right?
Yeah.
Well, with the COVID, the virus, it's got a lot of new variants now, which is very common for viruses to like mutate and change. And so, you know, you're seeing nowadays the vaccines are not quite as effective as they used to be. I mean, truly the initial series of the vaccines, at least the Pfizer one, was like 95% effective at preventing transmission. And it's like, oh, that's a no-brainer, right? Like, I mean, why wouldn't you take that? Especially when COVID was like literally, you know, murking people.
Yeah, I just got the first two. I didn't get any of the other stuff.
Yeah. Well, you know, I mean, back then it was an easy decision. And so, you know, nowadays, like, I'm kind of on the fence about it. You know, I think that, and this isn't the conversation we're about to have, but I mean, when it comes to should you take the vaccine now, I mean, in the past, I think it was a no-brainer. And now I think it's like, well, you know, the effective rate's gone down. It's not 95% anymore. It's somewhere 30, 40, 50%, which is, you know, kind of like what the flu vaccine is. And we have found that there are some risks now. You know, the way that vaccine trials work is when they're trying to vaccine, you know, they'll have like, I think in the initial trial for COVID, it was like 50,000 people, something around that range, okay? You're not going to find every possible thing that can happen in that small of a number. So what they do is they continue studies as the vaccines roll out into the general populace. And so there's two things that I've found, you know, with COVID that are kind of new information. And one is the risk of myocarditis, which is an inflammation of the heart.
Okay.
And the other is a vaccine-induced thrombocytopenia, which basically means you start to clot when you shouldn't.
Okay.
Now, these risks are very, very, very low. In fact, both of the risks of those bad outcomes are much, much lower than if you actually got COVID.
Okay.
You know, like say, for example, myocarditis, which, you know, that's not like a nothing problem, but it's not like a fatal problem generally.
Right.
You're much higher risk of getting myocarditis if you actually get COVID versus taking the vaccine for COVID, like by a factor of 10 or something, right? So you can look at those things and be like, okay, there's some minor risks, but, you know, should I not take this? Well, what's happened is I think that a lot of people who were very upset about lockdowns and mask mandates have really kind of made this like force of the vaccine is really, really bad. And I've seen it a lot on social media lately. And so my question for you guys is, have you seen this kind of like blowback on the vaccines that's happening? Or is it not something you've been exposed to?
No, I haven't really. I mean, honestly, I haven't like thought about COVID in a while.
Yeah, that's actually probably the best.
Yeah.
Charles, have you seen any of this stuff?
I've seen a lot of that. Yeah, I've seen a lot of that. Even with the past situation that happened with Damar Hamlin.
Yes.
It was a lot of people, like a lot of sector of people saying that it was because of that. So
Of the COVID vaccine.
Yeah.
Oh, did he get it, I guess?
Right, yeah, because I mean, the NFL, I think the NFL mandates that the players take the vaccine, and so when is it Damar or Lamar?
It's Damar.
Damar, okay. So when Damar had his event, which that was actually very interesting, he had, I mean, most physicians agree he had something called commotio cordis, which is where You take a blow to the heart at exactly the wrong time, which puts you into an arrhythmia, which causes your heart to stop beating. I mean, that is a demonstrated thing. It happens about 20 times a year in the United States.
Yeah.
It's very rare, but it's a very well documented thing.
Right.
Everyone kind of thinks that's what happened to him, and it
Yeah.
makes sense. Like, he took a blow to the heart, stood up, passed out. I mean, even though it's rare, that's probably going to be
Yeah.
your answer.
Right.
But you're right, Travis. Like, that was one. Like, and now it's like anytime any person on TV or the media has anything happen, there's this group of people that are saying, "Oh, it's because of the vaccine."
Right.
And what makes it worse is there's a bunch of like healthcare professionals and other people who are playing into that with really, really bad data. And I see it mostly on Twitter because Twitter's a little bit looser on like what people can, post.
Yeah.
And so, like there's like a Dr. Richard Fleming, Dr. Peter McCullough, Dr. Robert Malone, Dr. Pierre Corey, this guy who's not even a doctor named Alex Berenson. Like, these people are actually profiting from pushing like bad information about the vaccines. And what they do is like they, something will happen, they'll make a post about, oh, COVID vaccine's killing this number of people. And they're saying, come to my Substack and get a subscription and learn the truth. Or come read my book about, why the COVID vaccine is killing all these people. And so, of course, when all these questions came up, I started like looking into the data. I mean, it's just not there. I mean, I know how to read data. I used to do research studies for years. I would, review research papers to like see like, are they legit or not? And the data that these people present is, I mean, it's either wrong or just purely fabricated data. And so the reason I wanted to bring it up is what made me kind of like, I mean, one, I hate people profiting off misinformation. I mean, that just bugs me that somebody says, oh, I'm a doctor, listen to me, but then they push bad information to like make money. I mean, that is just literally the worst of the worst in my opinion. But what really kind of more annoyed me is now you have people that took the vaccine that are like afraid. They're like, oh, well, I took the vaccine, do I need to go?
Yeah, they think they're at risk for something.
Right, they think they're at risk for something that they're not at risk for.
Yeah.
And so I wanted to just like, do a little segment on that. And I'm not like, like I said, I'm not in any camp. I'm not pro-vaccine, I'm not anti-vaccine. What does the science say? What does the literature say on this? And yes, we have found that there are some, things that were not initially known about the vaccine that can happen, but they're very, very, very rare and not causing these problems that all these people are claiming they are.
Right.
I always say, like, if somebody's saying something that's, not mainstream, like, why would they do it? Well, in this instance, they're making money off of it. And I don't know, it kind of bothers me. I just wanted to bring it up. If you're out there, I mean, some people won't change their mind. There are people out there that will hear me talk and be like, oh, well, he's like a shill for the pharmaceutical people, or he's getting money. I mean, I'm not. I get nothing. I don't care if people take vaccines. I mean, I want people to be safe, but like, I'm not going to tell someone to go get a vaccine.
Yeah.
I don't get any money for someone taking a vaccine. And honestly, I probably will not take another booster for COVID, and not because of these risks really, but because of the fact that, one, the COVID variants are not as dangerous.
Yeah.
People are not dying like they used to be from COVID. Two, the efficacy, meaning what your percentage chance of being immune has just gone down and down and down. And so I'm really on the fence. I may or may not take another booster for COVID. So,
Yeah, just seems kind of like unnecessary.
I don't know. I mean, I think for some people, and I want to see more data, like, okay, with these new variants, like, does taking the vaccine mean that sick person will not get as sick and die? I do think that data still holds up, meaning if you have somebody like, my mom, she's 86 years old.
Yeah, like having pre-existing conditions.
Right. She's high risk if she were to get COVID. So, for her, even though the efficacy rate's much lower, I probably would still tell her it's probably a good idea to get it because any protection is better than none.
Yeah.
None,
Yeah.
right? For me, I'm kind of on the fence about it, but I just wanted to like, say that there's a ton of misinformation out there about it. And if you see a study that says something, you have to question these studies. I mean, it is a fallacy to believe that any study you read is accurate. People will make up data, they'll misrepresent data. You know, it's hard to believe that that stuff happens, but it does. I mean, I see it literally all the time. So, you know, talk to your own doctor about it if you have questions. You know, that's the best place to go, because it can be, social media is a bad place to get medical information. As we do a talk show about medicine.
Yeah.
As we do a talk show about medicine, it's not the best place to get
Yeah,
information.
but you always like talk to your doctor.
Yeah, talk to your doctor.
Yeah.
But I don't know. I just wanted to talk about that because it was something I'd seen a lot of, and it seems like it's getting worse. Like every time I turn around, it's like, oh, so and so, you know, had this bad outcome because of the vaccine. So
Yeah.
Anyway. What do you think, Travis?
So yeah, I don't really like feed into it. I think, like you said, there are new things that we are learning about the vaccine and like the boosters and everything, but I don't put 100% stock in a lot of the stuff that I see on social media. So that's definitely not, I don't get my health information from there. You know what I mean?
I know.
It's definitely not one of the things that I'm like subscribing to.
Yeah.
But
I just wonder if anybody had seen it. Like, I just, maybe it's because I follow a lot of medical stuff on social media. I just see it all the time. Like, oh my God, it's like everywhere.
And I'm not gonna lie, like in the African American community, like it's a big conversation. You know what I mean?
Is it?
It really is. It really is. And I think it's an important conversation to have, but a lot of times you have to take a lot of stuff with a grain of salt and just use, you know, discernment, and best judgment. So.
Yeah, I don't know. It's like, you know, people that are worried, I mean, another thing I'd say is like 98% of physicians took the vaccines willingly, you know, because we looked at the data on it. And I don't have any physician friends that are now like, oh, I'm so worried about, you know, this stuff. Like, it's just not a real thing, at least in the medical community. You know? I mean, obviously, keep doing the research, see if anything pops up. But I mean, as of right now, it's not there.
All right.
So, anyway, all right. That was our controversial topic for today. We're probably gonna get some hate mail for that. I hope we do. Hey, you know, hate mail is good too. If you think I'm wrong, tell me. I'd love to hear it. So, all right, you guys. I think that's about all the time we have. Thank you so much for joining us. Join us next week on Nip Talk.